Hello friend, welcome to our channel. Today we are discussing about megaloblastic anemia. First of all, what is anemia? Anemia is the disorder related to RBCs or decrease in the count of RBCs cause anemia led to megaloblastic anemia. In this session we are discussing its definition, etiology of megaloblastic anemia, pathophysiology, clinical presentation of megaloblastic anemia, laboratory diagnosis, and resource of vitamin B12 and folic acid, which is important. Definition of megaloblastic anemia. Megaloblastic anemia is a red blood cell disorder due to the inhibition of DNA synthesis during erythropoiesis. Mitotically, the inhibition of DNA synthesis impair the progression of the cell cycle development from G2 to M stage. These are the cycle in a cell cycle during the dividation of the cell. Megaloblastic anemia is a red blood cell disorder, RBC disorder, which occur at the inhibition of DNA synthesis during erythropoiesis. Formation of RBCs is called as erythropoiesis. At that time, there is inhibition of DNA synthesis which cause megaloblastic anemia. Etiology of megaloblastic anemias. Vitamin B12, also called as a cyanocobalamin or cobalamin deficiency. Folic acid deficiency, A and B vitamin deficiency. Vitamin B12 deficiency. Vitamin B12 is very important in our body. It is mainly gained by meat, milk, that type of products. Inadequate intake is common among the pure vegetarian people or old bed-ridden patient that they do not eat meat. That's why they do not get sufficient vitamin B12 for their body. Inability to absorb vitamin B12. After gastric surgeries or lack of hydrochloric acid in a gastric juice, lack of intrinsic factor. Intrinsic factor is very important for the absorption of vitamin B12 due to the auto antibodies to parietal cell. These are the various factors which are responsible for the inability of the body to absorb vitamin B12. Let's repeat this topic. After gastric surgeries, at the time of ulcer, gastric surgeries occur, internal bleeding occur at that time. That's why gastric surgeries, lack of hydrochloric acid in the gastric juice, which cause many diseases, lack of intrinsic factor in our intestine, or autoantibodies to parietal cell. Parietal cell secrete HCl, or autoantibodies destroy the parietal cell. Competition for interstitial vitamin B12. Competitive absorption of vitamin by fresh tapeworms which are present in our intestine, and bacteria overgrowth in a blind loop syndrome or intestinal stasis. Drug inhibition. Metformin, proton pump inhibitors are also responsible. Folate deficiency. Inadequate intake, a proper diet, old and bedridden patient, ICU patient, overcooked food, especially vegetables. That's why overcooked food is not rich in a content of vitamins and important ingredients in that food. Increased requirements, pregnancy, lactating mothers, growing infants, drugs. Hemolytic anemic patients, folic acid antagonist, methotrexate, chronic alcoholism, more intake of alcohol. It inhibits folic acid absorption. It increases folate excretion through the urine. Inability to absorb folic acid or following gastric surgery or chronic diarrhea. Pathophysiology. When vitamin B12 and folate is deficient in less quantity, thymidine synthesis function is impaired and DNA synthesis is interrupted by RNA synthesis remain unimpaired. Inability to synthesize DNA lead to inefficient erythropoiesis resulting in excessive hemoglobin. Excess hemoglobin and enlarged erythroid precursor being produced. Megaloblast means large cell that are produced and large erythrocyte precursor being produced. The developing RBCs or red cells has difficulty in undergoing cell division, but RNA continue to be transcribed into protein leading to the growth of cytoplasm within the nucleus lag behind. RNA, their function is to translate and transcribe, and which leads to protein synthesis. That's occur, but in protein leading to growth of cytoplasm while the nucleus being lag behind. Often one or more cell division are skipped, leading to a large than normal cell form. Clinical presentation, it include anemia symptoms, neurological symptoms, gastrointestinal complaints. Symptoms of anemia: weakness, palpitation, fatigue, lightheadedness, shortness of breath. Shortness of breath is for more oxygen. Premature graying of hairs, jaundice, pallors. Severe pallors and side jaundice combine to produce a telltale lemon yellow skin in a patient with megaloblastic anemia. Neurological symptoms include the syndrome usually begin with paraesthesia or numbness or tingling in the feet and finger, difficulty in balance and walking. For the 12 perspective, it is not very important that clinical preparation, but for the pharmacy it is important. Vitamin B12 deficiency cause a demyelinization of the peripheral nerves. The myelin sheath is present on the nerve, but vitamin B12 deficiency cause demyelinization of the peripheral nerves, spinal cord, brain, resulting in the more severe neurological symptoms, which may also reduce the capacity of the neurons to transmit the message or electrical impulse. When it is affect the spinal cord, it cause spastic ataxia or stiffness of the muscles with a uncoordinated movement. At the brain, it result in a dementia or psychotic depressions and paranoid schizophrenia. It is also been termed as a megaloblastic madness. Laboratory diagnosis of megaloblastic anemias: full blood count, FBC. There is also CBC, complete blood count, and there is a full blood count. Hemoglobin, this is not important for us. Bone marrow simmer. Bone marrow examination reveals myeloid cell exchange, giant bands, metamyeliocytes and hypersegmentations, and megakaryocytes are decreased and show. Biochemical test. Hyperbilirubinemia means increase in the secretion of bilirubin in our body. Increased lactate dehydrogenase LDH. Chilling test. Chilling test is used to determine whether there is a faulty absorption of vitamin B12. That important test. Chilling test is very important. Source of vitamin B12 and folic acid. Vitamin B12 is found in meat, liver, kidney, carbs, fish, eggs, cheese and other dairy products. And folic acid is from green leafy vegetables, broccoli, fruits, whole grains and dairy products. This is our today's presentation. Thank you for watching this video. Please like this video, share and subscribe this platform. Thank you friends.